Hi, I'm Haley Stark. I'm doing the histoplasmosis presentation with Kylie Morden. She was responsible for part one of the presentation, so I'm going to pick up on the symptoms for part two of the presentation. So just to jump right in, for the symptoms, some people who are exposed to histoplasmosis are asymptomatic or they don't have any symptoms at all, whereas other people can start to show flu-like symptoms, which I'll go into a little more depth on the next slide of just the specific flu symptoms. They're just kind of anything that you've experienced with the typical flu, but these symptoms can go away on their own. However, the symptoms start to show up anywhere from 3 to 17 days after the spores are inhaled or you are exposed to the spores. Most people who get symptoms will usually see them disappear anywhere from weeks to months, although some symptoms will last longer, of course, if the infection is severe, just like any other infection. And then people with weak immune systems can develop a long-term infection. And then just to go into depth about the symptoms, like I said, they're just any other typical flu symptoms like fever, cough, fatigue, chills, headache, chest pain, body aches, and you can get all of them or you can just have a few symptoms. And then for the diagnosis, you can take chest x-rays or CT scans of the chest. They can also collect samples of fluid from the respiratory tract, like your throat, They can also do tissue biopsies of the affected tissue. And then with that, they will examine whether or not a culture of histoplasma is grown from body fluids or tissues. That's kind of something that we've done in micro. And that picture kind of shows where you can see growth. So yeah, I just thought I'd add that in there. And then for treatments, sometimes they can go away without treatment. However, disseminated histoplasmosis in the lungs, chronic histoplasmosis, and infections that have spread from the lungs to other parts of the body may need a stronger antifungal called itricnizole. The treatment may take anywhere from 3 months to 1 year, depending on severity and immune status of the individual. Of course, with a suppressed immune system or a weakened immune system, it's going to be typically a little longer to fight off the infection. Okay, and to go into the at-risk population, as I've said numerous times throughout this presentation, I've mentioned the immune suppressed population or people with weakened immune systems. Individuals with weakened immune systems are at higher risk, as well as infants and adults 55 and older, just because they don't have a developed immune system like us younger kids do. And then for prevention, you should avoid areas or activities in the environment where histoplasma is present. Histoplasma is found in bird or bat droppings, so obviously you want to avoid that, like old tree stumps, anything like that. Obviously chicken coops where there's bird droppings, caves, there's bat droppings in there, obviously, and then cleaning or remodeling of old buildings, because oftentimes you would find bats in there. But anyways, just to move on, and then there's our references. Thank you.